Let us discuss the chemical injuries of the oral cavity. So one of the most common reaction to drug or the chemical is the allergic phenomena. So that could be either drug allergy that includes that is called as stomatitis medicamentosa or the contact stomatitis that is also known as stomatitis venenata. Now let us discuss the chemical injuries of the oral cavity. The first come is the aspirin. So aspirin, it is a local obtundant that is mistakenly used by many patients for the relief of their toothache, but they are harmful to the oral mucosa if they are applied locally. What you see is within a few minutes you will see the patient would see a burning sensation of the mucosa that will be noted, and the patient will see that his surface will become blanched, that is whitish in appearance. So the important feature is it causes separation and sloughing of the epithelium and frequently causes bleeding. So what is the feature of aspirin reaction? It causes blanching and sloughing of the epithelium after the local application of the aspirin tablet. Now what are the chemical injuries due to the endodontic material? Endodontic material would cause soft tissue damage resulting in the deep spread of inflammation, and necrosis may be seen due to usage of some endodontic material or their injections into the hard tissues. Now let us discuss these materials. The first comes the sodium hypochlorite. Sodium hypochlorite, it is the most common used root canal irrigant. Why? Due to its efficacy against the pathogenic organism and pulp digestion. So it is found to be sporicidal, virucidal, and has a greatest tissue dissolving effect on the necrotic than the vital tissue. So on the contact with vital tissue, what you would see is the sodium hypochlorite will cause hemolysis, ulceration, facial nerve weakness, and necrosis. It damages the endothelial cells and fibroblast. Inadvertent injection of sodium hypochlorite solutions into the periapical tissue would lead to emphysema due to the oxygen liberation into the tissues. Gattaparcha. Gattaparcha is a biological inert material that is used to obturate the space inside the root of tooth during the endodontic treatment. This results in ineffective periapical periodontitis that is caused by extrusion of the gattaparcha, as there is transport of the bacteria beyond the apex, or due to incomplete cleansing or for the foreign body reactions. Hydrogen peroxide, on contact with the skin, it burns the tissues and releases toxic free radicals, so it should be handled with care. Next comes the sodium perborate. It is used as mouthwash, bleaching agent, and in dentifrices. You will note that it will cause inflammation, edema, and ulceration of mucosa can be seen with this. Next, the drugs that are used systemically. First comes the dilantin sodium. It is an anticonvulsant drug that is used for the control of epileptic seizures. What is the effect of this dilantin sodium on the mucosa? You will see it will cause hyperplasia of the gingiva. So gingival hyperplasia that will begin as early as 2 weeks after the dilantin sodium therapy, and it will take 2 to 3 months. The first change you will note is the painless increase in the size of gingiva. So there will be enlargement of the interdental papilla. The surface of gingiva will show increased stippling, and there will be cauliflower gingival tissue that would be lobulated and cleft remains between each enlarged gingiva. On the palpitation, you will you will see that the tissue is dense, resilient, and insensitive. So this hyperplasia of the oral mucosa, it is entirely confined to the gingiva of the gingival tissue surrounding the teeth. So no treatment is necessary until the enlargement becomes aesthetically objectable. So the treatment part consists of the surgical excision, discontinuing the use of drug will result in diminishing of the dimension of the bulk of the gingiva. Next drug is the cyclosporine. Cyclosporine, it is a selective immunosuppressant that is used in organ transplant patient to overcome the transplant rejection. So it will cause generalized, it will cause gingival hyperplasia, as similar to as that of Dilantin. Another drug is nifedipine. It is a calcium channel blocker. It is used in cardiovascular diseases. The calcium channel blocker interfere with the production of collagenase through the altered calcium influx into the fibroblast. So what you will see is there will be gingival enlargement that would be seen 1 to 3 months after taking of this drug. The gingiva will be firm, nodular, and the clinical appearance is as similar as that of seen in Dilantin and cyclosporine. Next comes the lead poisoning. Lead poisoning, another name is plumbism. So for your entrance exam, the plumbism, it is another name for the lead poisoning. It is an occupational hazard because it is seen due to the accident exposure. The chief mean of poisoning is through inhalation of the lead vapors or the dust. And in infants, the most common cause is ingestion by the child while chewing on wood painted with lead containing paint. So the lead intoxication is mainly manifested by GIT disturbances that will cause nausea, vomiting, colic and constipation. A peripheral neuritis will also develop that will produce the characteristic feature like wrist drop or foot drop appearance. So the wrist drop appearance seen in lead intoxication. So formation of lead line is as similar as that of bismuth line. So there will be grey or bluish black line of the sulfide pigmentation that occurs in the gingiva. But it is sometimes more diffuse than what is seen in the bismuth poisoning. Excessive salivation and metallic taste are also common complaints. The treatment is secondary to the systemic treatment and prognosis. Mercury poisoning. It can be either acute or chronic. In the chronic mercurialism, that is characteristic by GIT disturbances, diarrhea, excitability, insomnia, headache, mental depression. There is increase in flow of saliva, metallic taste in the mouth due to the excretion of mercury in the saliva. The salivary glands that would be swollen, and the tongue is sometimes enlarged and painful. Ulceration on the gingiva, palate and tongue are most common. You will see deposition of dark sulfide compound. Lead lines may occur. Lines may be seen as similar as that of lead lines and bismuth poisoning. You will see deposition of dark sulfide compound. There will be loosening of teeth. What is acrodynia? Acrodynia is the pink disease or swift disease that is associated with the mercury toxicity. So that develops in the young children below the age of 2 years. Although children of 5 to 6 years may be affected. So the skin of the hand, feet, nose, ears, cheek, they will become red or pink, and the child will have cold, clammy feeling. The appearance has been described as resembling raw beef. So here sweating is the feature of acrodynia. There will be irritability, photophobia with lacrimation, muscular weakness, tachycardia, hypertension, GIT upset, stomatitis in the children, profuse salivation and dribbling. The gingiva will become extremely sensitive, painful, and showing ulcerations. So the treatment could be antidote. The antidote for mercury poisoning is dimercaprol or D-penicillamine. Tetracycline discoloration that may be seen in deciduous or permanent teeth. So what you see is there will be, so the critical period for the tetracycline induced discoloration in the deciduous dentition is nearest 4 months in utero to 3 months postpartum for the maxillary and mandibular incisors, and 5 months in utero to 9 months postpartum for the maxillary and mandibular canine. So what you will see, there will be, the child will have yellowish brownish gray discoloration which is most pronounced at the time of eruption of teeth. This discoloration will become more brownish after exposure to light. The tetracycline, as we know, it is a fluorescence. It shows fluorescence under UV light, and therefore the teeth involved by this discoloration also show fluorescence under the UV light. Minocycline will cause discoloration of skin, nails, conjunctiva, bones, and teeth. So you will see a blue-gray appearance due to the black bone showing through the thin transparent membrane.